All right, good afternoon, everybody. Welcome to the PrEP webinar. My name is Jen Sperduto, and I'm joined by my colleague, Dawn Reinhardt-Wood, and we're from the Department of Psychiatric Rehabilitation from Rutgers, and we are part of the SPRE team, which is the State Hospital Psychiatric Rehabilitation Initiative. And today, we are joined by Terri Roth from Trenton Psychiatric Hospital. She's the Director of Vocational Services there. And our title today for our webinar is Supported Employment Works. Get it? Works. The role of work in recovery. So let's tell you a little bit about that. But before we get started on the webinar, we want to let you know this is an interactive training. We encourage you to participate throughout. Please feel free to ask any questions. You can type in the chat box. If you change the chat box to everyone instead of host and panelists, everyone will be able to see your question or your comment as part of the discussion. If you just want it to go to Dawn or myself, then you can just leave it at host and panelists, but you can change that. Also, as you know, if you've been here before, there's going to be, this is a recording, and a recording of the webinar will be available on the SPRE website, and Dawn's going to post that link in the chat box. Also, at the end of this presentation, there'll be a link for a training evaluation, and that training evaluation not only has some questions about the actual training, but it also has a section for resources, a copy of the handouts, all the videos that Terri is presenting today, along with some additional resources. And if you complete these training evaluation, then you can, if you add your email in, you can get a certificate of attendance for attending today's webinar. Okay, so just as a quick disclaimer, today's webinar is part of the PrEP program. It's an online forum for a variety of topics that are relevant to state hospital staff. And while Rutgers and DBHS are co-sponsors of the program, the PrEP webinars are peer presented, and so that the content is independently developed by the presenter each month. So therefore, the views and opinions expressed in the program are those of the speakers and don't necessarily reflect the views or positions of any entities they represent. So again, this is being recorded, and I'd like to introduce Terri Roth, our presenter today. Some of you may know Terri is the Director of Vocational Services at Trenton Psychiatric Hospital. She oversees the vocational training programs at the hospital, which include the New Leaf Garden program, Gardeners program, food service workers, grounds crew, clothing mart, business center, as well as vocational groups, which include vocational IMR and vocational PrEP. Her focus is developing vocational training programs that prepare patients to successfully obtain and maintain jobs in the community upon discharge. So with that, I'd like to turn it over to Terri and take it away.
Thank you, and thank everyone for coming this afternoon. Hopefully everyone will learn something new about supported employment. Just to give you a little overview of it, supported employment is an evidence-based practice in which individuals with serious mental illnesses are provided with services to assist them in obtaining competitive work in a community. They also provide necessary supports to ensure their success in the workplace. So a couple of things that we want to talk about. Competitive work is defined as work that pays at least minimum wage, and it's the same work that you or I would look for if we went looking for work in a community. So we're going to take a look at that, and this interactive training will explore the benefits of work and the role of work in recovery for people with serious mental health conditions. We'll provide an overview of supported employment at the state hospital, discuss the barriers to employment, and highlight some of the unique strategies the hospitals are using to prepare individuals for working in a community post-discharge. Next slide, please. At the end of this module, you'll be able to define supported employment, understand how supported employment will benefit our patients, describe the benefits of working in a community, understand when a person should start working in a community, and the supported employment process. We'll also take a look and recognize how working will impact other programs or benefits, which is a big question that's asked not only by patients, but also by staff. Next slide. So just take a little poll real quick here. How long after discharge should a person wait to work? So the poll's up on the screen, and you can lock in your answers. Give everybody a couple minutes to do that. Any responses in the box?
Oh, yeah. So
Okay.
as soon as I end the poll, you let me know.
Okay.
84% participation. So
Oh, very good.
end there and share the results with everybody, and you can see what
Okay.
everyone voted on.
Okay. So we have 32% say immediately, 32% say 30 days, 60% is around, 60 days, 18%, and 18% for 90 days. So the thing that we want to look at is that there are several studies done, some of which we're going to take a look at today, to show the importance of working immediately after discharge from the hospital. The next slide, please. We're going to talk about this in the next slide. So SAMHSA defines the four major dimensions of recovery as health, home, community, and purpose. Purpose being conducting meaningful daily activities such as a job, school, volunteerism, family caretaking, creative endeavors, etc., independence, income, to participate in society. So we want our patients to work as soon as they go into the community, because what are they doing for the first 30 days? You know, some of the answers I get are, well, they're not quite ready to work yet. Anybody put in chat, what does ready to work look like? I've been doing this for many years, and I'm not quite sure what ready to work looks like. You know, we have people working at the hospital. They work at the hospital here, a lot of them for their stay at the hospital, and then they go into community, and I'll hear, well, they're not ready to work. Well, they've just been working for 6 months, 7 months. So we want everyone to understand that it's a responsibility of everyone to make sure that we get as many people working as we can immediately after leaving the hospital. There's an article written by Joe Marone and Ed Golakwa, which is called "If Work Makes People with Mental Illness Sick, What Do Employment, Poverty, and Social Isolation Cause?" Good question. Things that they have found is that it doesn't get easier later on. Delay in entry does not make it easier, and it does not make it better for the patient. And a lot of people talk about, well, you have to have some life success and reacclimate into society before you can work. Marone and Galakas have shown that life success does not necessarily mean work success, but work success helps with life success. So we want to get our people working as quickly as possible so that they not only have work success, but it also helps them with their life success. I'll give you an example of a patient who wanted to work at TPH. So our process is we get a referral from the team, and then we do an interview, and then the person starts work. So I got the work referral, and the rehab rep brought the patient over for an interview, and she was so distracted I couldn't get past the first question. So we felt it was best to end the interview and bring her in again. And the next time I got maybe to the second or third question. So I said to the rehab rep, listen, I know Samantha or the patient really wants to work, so let's have her work and see what happens. So we brought her over and we had her work with the crew, and she was phenomenal. And afterwards I sat down with her and completed the entire interview. And it was just amazing to me that she couldn't quite get it done beforehand, but once she worked and she had such confidence about herself, she was able to complete the interview. And it's because it gave her purpose, which is exactly what the 4 dimensions of recovery talk about. People have to have a purpose. It's different for everybody, but for a lot of people, it's work. Because if you think about it, when you meet people in a community, what's the first question you ask? Hi, what's your name and what do you do? You know, so it's something that's important as part of life. And a lot of people think that you need to get your life in order before you can work, but actually it's the exact opposite. Work will help you get your life in order for a lot of people. Let's go to the next slide. So one of the questions, or one of the areas that we review with patients is the benefits of working. Everybody knows the obvious benefit, you get paid. But some of our patients also choose to volunteer, so there's not that aspect. So what do you think the benefits of working are? So this is, you can put this in a chat, or you can scan that QR code that's on the screen.
Yeah, so Dawn posted the link in the chat, so you can either just click on it, or if you have your phone handy and it's easier to do that, you can just open your camera and scan that code. And this will bring you to a program called Menti, and you can enter some of the answers that you would like to answer that question with, and we're going to create a word cloud, and I'm going to show you what that looks like. So you all start entering some answers, and I'll show you what the words come up. Just confirm you can see the screen.
Yes.
Okay.
So think of all the benefits that you get from working. So these are some really good answers. We have purpose, connection, meaning, accomplishment, structure. One of the biggest things when we talk to patients about it, one of the biggest things that that they bring up is providing structure to their day. It helps them with the schedule. They even talk about it when they're here. They know when they have to work, and you know, they have groups that they have to go to and everything too, but when they have to work, they make sure that they're there on time, and we make them follow the same procedures that you would follow in the community. And you know, it helps them with building relationships, responsibility, making money, obviously, self-esteem. Another one of the biggest things that we see in patients is developing their self-confidence. In the links at the end, there's a video from SAMHSA. It's called Introduction to Supported Employment. And that's a really good video. It touches on a lot of different aspects of supported employment. And at the end, one of the biggest things is this one girl talks about how out of everything else, the thing that it gave her was confidence. And it just helped her in her everyday life, because not only because of the work that she was doing and the structure and the money, but it helped to develop her self-confidence. And that's something, I mean, look at all these things on the screen. And isn't this something that we want for ourselves? And it's something that the patients want for themselves. And it's things that, as a vocational department here, we certainly want for our patients as well.
And just a note about the word cloud, the words that you see bigger mean that they've been entered as answers multiple times. So many of you answered structure, purpose, meaning, accomplishment, responsibility. Like those bigger words are multiple answers. So,
yeah. So now I want to take this and print it out and put it up in my vocational room.
I can send you this, Terri.
Yeah. I
Okay.
think it's great. I mean, there's just so many benefits to working, and people don't realize it until you start thinking about it. Okay, back to the slides. So the next thing I want to talk about is I'm sure a lot of people know Pat Deegan was diagnosed with schizophrenia as an adolescent and made a commitment to herself that she was going to, that they were wrong about her, and they were so wrong, she was going to become Dr. Pat Deegan, and she was going to change the way the mental health world provided treatment. So we use a lot of her videos in our training, and she has, in this video, you'll see, she talks about the Vermont system, which is based on rehabilitation, and the Maine system, which is based on maintenance. And as you go through it, you'll see the big difference between the two. If you can roll that first part.
Now, what's interesting is we do have really important research on this topic. It was done down in the States, and we had the opportunity when state hospitals were closing to look at the impact of two different kinds of state mental health systems. The Vermont system was a system that was based on a rehabilitation model. In other words, in the system, if you were in the mental health system in Vermont and you were being discharged as the last cohort, the last 300 or so people to be discharged from Vermont State Hospital, the mental health system was based on rehabilitation. The expectation was that people would become self-sufficient and would work, and the expectation was that people would live in real housing, meaning housing that was indistinguishable from housing that other citizens live in. Okay, so you wouldn't have clustered apartments, but if you did have apartments, they would be integrated, and all sorts of people would be living in these apartments, including people who had been in the state hospital. So that was the Vermont system, from the top right down to the frontline worker. We're going back to work or volunteer. I mean, we're going to be busy, right? We were expecting this, and this is the final cohort, the last 300 people to come out of the state hospital. So we weren't cherry picking these folks. And by the way, this study was done by Michael DeSisto and Courtney Harding. Then there was the Maine system. And in Maine, the mental health system was based on this stabilization and maintenance model. Let's stabilize them, and then we'll maintain them in the community. And the expectation was that folks were going to remain on benefits for life and that they could not work. In fact, it would be cruel to ask people with serious mental disorders to work because of the stress involved. They would just relapse.
Okay, so, that's a lot of the thought of a lot of people in the community, that people should wait. It's too much. Let them get out into the community and reacclimate, and then we'll start them back in, because it'll be too much stress in the beginning. But studies have shown, and if you roll the next part of it, that this is not the case.
365. And so we had two cohorts all coming out of the state hospital, two very different systems, just a couple of states apart, and an opportunity to match the 300 or so folks in each of the cohorts and to study what happened to them over a period of time. And here's the really fascinating finding, in my opinion, is that in the Vermont system, 13% of folks went back to the hospital at any point in time in a given year. And that was for 16 straight years, right? In the Maine model, which is the stabilization and maintenance, the custodial care model, people were returning to the state hospital at a rate of 50%. Whereas in the Vermont system, people were maintaining independent living, for an 11-year period, 50% approximately. So it's interesting because in the article, Dr. DeSisto and Harding asked the big, huge question. Why did people in the state of Vermont do so much better and so consistently better over time than the folks in Maine? which was the stabilization model, the custodial model. And what they concluded was that the people in Maine, quite literally, would say, hey, there's really no difference between living in the community and living at the state hospital. There are nice people at the state hospital too. At the state hospital, you can get nice meals and have interesting things to do, and it really doesn't matter to me if I'm in or out. Okay? Whereas the people in Vermont, they had a reason to get up in the morning. They had to get to work. They had to get to their volunteer job. They had grandbabies to take care of, okay? And so this is where I think a huge answer to what the recovery model is all about. And in the recovery model, we understand that boredom and that having no meaning and that having no reason to get out of bed in the morning is profoundly stressful and creates a life where you feel like it has no meaning or high purpose in it, that there is no reason to get up in the morning, that nobody needs you. Why get up, right? So for me...
So interesting, right? So if this was a study from DeSisto and Harding, in Vermont, where it was a recovery model, only 13% returned back to the hospital. But in Maine, where it was a maintenance model, about 50% returned back. So since we've been doing supported employment at the hospital here, we've referred 194 people to supported employment. And out of those 194, only 2, when I last checked, have returned back to the hospital, and that's 1%. Out of the others, I don't have the statistics on the others that have returned, but I'm pretty sure it's higher than 1%. So Vermont had more productive, the patients were more, or the clientele in the community were more productive. They had less symptoms, displayed better overall functioning and community adjustment, and had better work outcome. So definitely statistics here to indicate that we should be referring our people as soon as they leave the hospital. So next slide, please. A few things about what we're doing at the hospital. So, excuse me, we have career scope that we do, which is an interest in an ability inventory, which helps patients to determine which their best vocational choice would be. We try to do that before they are referred to supported employment, so we can review with them and help them to be able to pick a job. Because remember, the only qualification for wanting to do supported employment is that they want to work in the community. Excuse me. So we also do vocational IMR. Hold on just a second. I apologize for that. I just need a minute.
Poor Terri woke up sick this morning, and she's been a trooper trying to get through it and not leave everyone hanging for the webinar today. So let's give her a sec.
Okay, see if we can get through this. So the classes that we offer at TPH are, we have illness management and recovery and vocational preparation classes. So during these classes, during vocational illness and management and vocational IMR, we discuss how to manage your symptoms when you're working and develop a relapse prevention plan to be able to, if they start to have symptoms when they're at work, to be able to handle them. We teach them about triggers, we teach them about early warning signs, and the supported employment job coach will also help them with that once they're in the community working. We have vocational prep classes where we discuss things like soft skills in the workplace, how to manage, you know, if your coworker smells bad or your boss is annoying, how to handle those kind of situations. We also have a cell phone program, which I'll get into a little bit more when we talk about barriers. And we'll talk a little bit about that then, but that's been a real big help to connecting people with supported employment. The biggest thing we do are the vocational training programs, where we have jobs at the hospital where they work. At TPH, we work at the greenhouse. I have 2 greenhouse programs, one in the locked unit and one our main greenhouse. And right now, you know, we're limited because of COVID, but we have a grounds crew working. We have 2 business center sites. So they learn skills that will help them in a community be able to secure a job, first of all, because they already have some experience, and maintain jobs. People working at the greenhouse programs can get jobs at Lowe's, Home Depot, any of the local nurseries. People working in the business center probably already know how to do most of everything they do at Staples, and you know, any of those Minuteman printing shops, any of those kind of things. Next slide, please. So in our voc class.
I'm sorry, Terry, it's Dawn. I just have one question I was wondering if you could touch on
Oh, sure.
from the chat. Margaret has a question about how does Voc IMR differ from basic IMR?
Because we focus on learning their symptoms and how to manage them while they're working. That's the big difference.
Thank you.
Okay. Barriers to employment. Now, these are things that either our patients have told us or our supported employment providers have told us, or from our experience. So transportation, I'm sorry, transportation is sometimes an issue, sometimes not. Of course, most of our patients, when they leave here, do not have cars readily available to them. Some do, but most of them rely on public transportation. For some areas, it's not a problem. For other areas, if they're not near a city, if they're in a remote location, or a rural location, then it's a little bit more difficult. But the supported employment provider will help them with that too. Another barrier is the day program. Most of the patients leaving obviously will go to a day program. And the biggest question is, how can I work and go to day program? Or, well, no, we can't refer the person to work because they have to go to a day program. So the short answer to that is, who wants to go to a day program all the time? And there's plenty of hours in a day, and there's other days in a week where they're not going to the day program. And the 2 providers will work together to make a schedule that's going to work for everybody, okay? But the main problem is that we want them to be able to go to work at some point in time. Most of the patients, because they're working part-time, could attend a day program during the week and maybe work part-time on weekends, or they could work in the evening, things like that. Lack of a cell phone became a problem brought to our attention by the supported employment providers. They often told us that they were not able to get a hold of the patient in the community because the phone numbers didn't work or they weren't at that location anymore. So we took that to the division in our vocational directors meetings and came up with a cell phone program where people who were referred to supported employment left the hospital with a cell phone that was paid for 1 year. And that enabled the supported employment providers to be able to connect with them and speed up the job process. Also, most of the applications now, when you're applying for jobs, are online. So you need to have access to online in order to fill out the applications. So, of course, there's other places they could go. The library is one of them. But you still need a cell phone for people to call you for a job interview. So the cell phone program started April 15th of 2021. And since then, our feedback has been that it's been very successful connecting our patients to supported employment. So that's a really good barrier that we've crossed there. Impact on SSI, it's a little bit different for everyone. The basic formula is basically the same. It depends on SSI or if they're getting SSI or SSD. And we're going to watch a little video on that in a minute. But the bottom line is, if you work, you can still collect SSI and you end up making more money. You might get less SSI, but you're going to make more money. And the other thing is poor or no job history. This is very common for our patients. A lot of our patients, if you think about it, with the onset of schizophrenia being early, late teens, early 20s, that's when most people are beginning to develop their career or get their work experience. So a lot of our patients come to us with no job history at all. They've never worked in the community, or they work. Today I interviewed somebody for supported employment referral, and they had 2 jobs in the community before they came here. Each one was 2 weeks. So a lot of them don't have any job history. So it's an obvious barrier, and it's things that we have to overcome. However, working in the hospital gives them those skills and gives them the opportunity to be able to gain some experience in those areas. Next slide, please. Okay, so patients working in the community, they ask us, well, where am I going to work? How much should I work? And what about the day program? So they're the same questions that a lot of staff has too. So as far as the where goes, the supported employment provider will sit down with them and discuss what kind of jobs they're looking for, and then help them look for those jobs. The supported employment providers, a lot of people have the misconception that they have special jobs that they put people in that come from the state hospitals or any other agency, any other person that's coming to them with severe mental illness. They don't have a list of jobs where they just, okay, we'll put you here, we'll put you here. It's going to be the same job process, same job search process as you or I would go through in looking for it. But they're going to sit and they're going to talk with the supported employment provider, who is really their job coach, and find out where they can work. And how much should they work? That depends on what their day program is, which is the next question. How many hours can they work out that they can work out and that they could work and still go to day program, and how much they should work. The provider will also sit down and go over that with them too. But since it is a big question, we do review that with them here. And the next slide, which you can go to, has a little video. I think it's just like a 4-minute video on how working connects with Social Security. And it always, the title of the slide is "It Pays to Work." And you'll see that it's always more beneficial to work than it is to just collect Social Security. And remember, it's not just about the money. It's more beneficial monetarily to work. But remember all those benefits we spoke about earlier. You can play the
Supplemental
video.
security income and work. A Griffin Hammis production tailored for Idaho. Do you receive SSI? Have you ever wondered what would happen if I work? Well, I'm here to tell you there are 3 great things that can happen when you work. 1, you'll have more money. 2, you can stay connected to SSI. And 3, you can keep Medicaid. That's a good deal. It means if you go to work, you can get ahead and keep the safety nets you need. Now, there's a lot of confusion out there about SSI and work. So let's get the facts straight. SSI fact number 1. If you work, you'll have more money. Really? How's that possible? Let's say you land a job making $1,200 a month. That sounds great. Can you guess how much your SSI would be? I'm guessing it would be 0. Actually, it's possible you could still receive some SSI. You see, when figuring out your benefit amount, Social Security reduces your SSI by about half of whatever your wages are. If you started with $783 of SSI, in this example, it would likely reduce to $225. So you'd have $1,200 of wages plus $225 of SSI for a total of $1,425 a month. Wow, I thought I'd have less money if I worked. Nope, by working and earning this amount, you'll almost double your monthly income. Pretty cool, huh? Yeah, that's great. SSI fact number 2. You can stay connected to SSI when you work. Let's say you get a really great job making $1,800 a month. Cool. When you earn this amount, your SSI would be $0, but you'd still have $1,800 in wages, so you'd be getting ahead. Well, I like the idea of having $1,800, but what if I lost my job? Then what? That's exactly what this is about. If earnings make your SSI drop to $0, you can keep SSI eligibility status. This is a safety net that keeps you connected to the system. So if you lose your job, you can just tell Social Security and they can quickly restart your SSI. Wow, that's great. You're right. And the name of this great safety net is 1619B. SSI fact number 3. You can keep Medicaid when you work. Many people. Supplemental security income and work. A Griffin Hammis production tailored for Idaho. 1,420 ahead. Well, I like the. If you lose your job, you can just tell Social Security and they can quickly restart your SSI. Wow, that's great. You're right. And the name of this great safety net is 1619B. SSI fact number 3. You can keep Medicaid when you work. Many people with disabilities rely on Medicaid for important services. Yeah, I'm one of those people. I use it for going to see my doctor and medications. Well, I've got great news. Because you get SSI, there are ways you can keep Medicaid when you work. Really? How's that possible? Well, if you continue getting some SSI when you work, you'll simply keep Medicaid because your income will be low enough. And if you work so much that your SSI is 0, you can still use the 1619B safety net we just talked about to keep Medicaid. That's fantastic. To use 1619B, you need to follow all the SSI eligibility rules, but in Idaho, you can earn over $39,000 a year. Wow, that's incredible. So, the moral to this story is, by working, you can have more money, stay connected to SSI, maintain your Medicaid, and have a better quality of life.
So,
Terry, we have one question that I want
okay.
to relay from the chat. Angela asks, how does one's legal history and or substance use history affect their ability to be employed through this program? And I'm assuming that they're talking about supported employment, I believe. So if I guess if you wanted to answer that after addressing this video, that's fine.
Sure. So you can see how working always gives you more money than just Social Security. And the object is, Social Security is a good safety net, but if a person is able to work full time and make money and get those benefits from working full time, then that's what they should do. They always have that safety net to fall back on. But working will always give them more money. The gentleman I was interviewing today, when I asked him what his long-term goal was, it was to get a full-time job and get off of public assistance. So, hopefully that'll come to fruition for him. And I'm sure it will. So, all right, in answer to the question, could you read that to me again, Dawn?
Yeah, absolutely. How does one's legal history and or substance use history affect their ability to be employed through this program? And I'm assuming they mean through, supported
Supported
employment.
employment. The only qualification for supported employment is that they want to work. There are no other qualifications. Now, in the beginning, we did have one provider that would not accept Megans, or would not accept it if a person if they had a violent crime. So we took that to the division, and those people have to work too. So they're eligible for supported employment, but the provider will work with them to find a job that is within their realm of areas that they should be working. There would be some where they wouldn't, for instance, if you have a Megan's that's a pedophile, you don't want to have them working as a janitor at a school, things like that. But as far as being eligible for supported employment, everyone is eligible. The only qualification is that they want to work. I hope that answers the question. Okay, next slide. So this is the supported employment process. It's very similar in all the hospitals. The first thing is, like we said, does the patient want to work in a community upon discharge? If the answer to that is yes, then the referral process begins in a hospital. Usually it's the social worker who sends in the referral process because they're most involved with the discharge and has the information, the information needed on some of those areas. So they send us a referral and that starts the process. We have interview with the patient to complete the process and make sure we have all the information correct. And then we contact the supported employment providers. Supported employment providers in the community are in every county. So each county has its own provider. And we contact them. We usually do a meet and greet with them. Lately, it's all virtual. Before, they used to come into the hospital. But they do a meet and greet. And then when the patient is discharged, then we let them know, and they'll contact the patient in the community. Now, the advantage of the cell phone program is that one of the things that we do when we do a cell phone training with the patient is when they're practicing entering contacts, one of the contacts that they enter is a supported employment provider. So they leave here with that person's phone number in their phone. And we tell them, if supported employment doesn't contact you within a week after discharge, give them a call. And we have had that happen with several patients when they got discharged, called supported employment themselves. So that's really awesome. And then 30 days later, we'll do a follow-up. We do it for two reasons: for to follow up how they're doing with supported employment, to make sure they got connected, and to make sure that everything is good with her cell phone. Any questions on that? Okay, next slide. So this is just a little bit of information about supported employment at TPH. The initiative, this is going back to Governor Christie started an initiative in the state hospitals that was supposed to start in late 2014. We had our first patient referred to supported employment at TPH in 2015, and since then we referred 194. This is our chart by year, so if you take a look at it every year, mostly we've increased. We even increased during the pandemic. We still referred. If people were getting discharged during the pandemic, we still referred. That's when we started doing virtual conferences with the providers and the patient for telehealth. And every year we've increased. 2021, we had a big increase, and so far this year, we had 8 when I did the slide, now we have 10. So we're on track. Some of the other things that we've done at TPH to prepare our patients, we have some workshops that were being held. We've done peer support training, specialist introductory training. We've done a training that came from TIPS, which is a Rutgers program, teaches people how to use public transportation. We've done a workshop for New Jersey Reentry Corporation and from NJ Win. NJ Win, if you're not familiar with them, they are a very good organization, and they're the experts on how working impacts Social Security. So we generally have them come in and do a little presentation with our patients every year. We haven't done it because of COVID, but they're a very good resource. We've also done supported employment fairs. We used to do them yearly. We invite supported employment providers. We invite New Jersey Wins, Disability Rights, the VA, 2 organizations that provide clothing to people looking for jobs for their interviews. Dress to Success and Dress to Impress come. The federal bonding program, which is a big program. I'm not sure, I think it might have been Angela asked a question about if they have a criminal background. Well, a lot of places want their employees to be bonded. And a lot of times, if you have a criminal background, you cannot be bonded. Bonding is like an insurance policy where if something gets stolen and somebody stole it, if that person was bonded, the company would get the money back. So there's a program called the Federal Bonding Program, which the federal government provides a bond up to $25,000, and it doesn't cost anything for the consumer or for the employer. And we set that up here. All that I have to do is get the patient to sign a release so I can send their name to the Department of Labor, and we get back a certificate that says that they are eligible for a federal bond. And that certificate never expires, so I can give it to a patient today, and 10 years from now, it would still be good. And they can give that to an employer, and it kind of gives them a little edge over somebody else because they can get bonded. So those are some of the other things we do here. Just a little more history. We've had some patients who have left from here and already had full-time jobs. We had one person leave that was a full-time electrician. Another person left that was secured full-time employment at Walmart with benefits. We've had people work in grocery stores, nursery homes, factories, office buildings, cleaning office buildings. So there's, a lot of different places where our patients have gone. We've also had a job fair here where we had employers come in, and actually it was like a regular job fair. TLU patients came, we took them all to go get attire for the interviews, and we had 2 people get callbacks for jobs from that from that job fair. So that was pretty exciting too. So a lot of things going on at the hospitals. I know the other hospitals are doing a lot of stuff too. Everybody's working hard to prepare our patients for discharge and to get that job in the community so that they can be successful in the community and remain in the community. Next slide. Oh, that's great. Did you see what Shauna wrote in the chat? About one person finished at Mercer County and now works at Lexus. So that's awesome. That's very awesome. What other questions do you have? Any other questions in the chat, Dawn?
No, there is not. We have been keeping up with them as we go along.
Okay. So that's all I have for today. If anybody else has any other questions, I'd be happy to answer them. Here's some resources and reference. These Pat Deegan videos are really good. So if you haven't seen them yet, those are some really good ones. And the, I don't see, I'll have to send it to you. I thought I put on there the introduction to supported employment.
I just have what you gave me on this one.
Yeah, I must not have put it on. I'll have to send it to you and maybe you could send it out.
Okay. If all of these links and videos are available on the training evaluation, Dawn's going to post that link for you. If you don't get a chance to enter it or to click on it today and fill out the evaluation, I will send it out to you in the morning so that you can have access to all of the resources, as Dawn just said, and all the links. The videos are really good if you have them, if you have a, you know, a little bit of extra time to watch the whole thing, and you'll get the certificate of attendance. I do believe there was a question that came in.
Yeah, there are a couple questions now. Renee, I believe it is, she did raise her hand. Oh, let's see. Yeah, Ray Rivera. Okay, I'm gonna turn your mic on, Ray. You should be able to talk now on mic. If you didn't want the microphone, I can just relay your message from the chat.
So the question is, have you ever met a client that it was best to wait a while before working? You know, I thought I did when I met that one client until I took her out to work. And then that was when it really hit me that, you know, she just really wants to work. The other stuff is secondary to that. So I'm sure there are few and far between, but you know, generally speaking, and you can see from the statistics that it's better to work immediately upon discharge. And like I said, when, you know, I tried interviewing that person twice, couldn't get through the interview, and then I took her out to work and it was like a miracle. Tom also asked, what can staff do to help? The biggest thing is that I've encountered is that there's a lot of talk when we talk about discharge planning for housing and things like that. But if we could include that one question, do you want to work in the community upon discharge? I think that would be the biggest thing, and to let the vocational staff know. And if they do want to work, and we should be asking that early on. And if they do want to work, get them involved in the work training programs, the vocational training programs at the hospital, so they can get back into working and get back into making money and having all the other advantages of working. It's really good to see here when I see my patients working together and helping each other. I mean, it's, you know, they could be patients that don't really interact when they're on the unit, but then they come to work and now they're interacting, and it's really just a great thing to see.
We also have a question from Angela. Can someone not in a hospital take advantage of these resources?
Yes, the supported employment providers are not just for the state hospitals. And that was a big question back in 2014 when this started, that, well, you know, our patients are getting out of the hospital, and we're letting you know, and where are they going to go on your list of people, because a lot of them had waiting lists. And we were assured that state hospitals, the patients coming from the state hospitals would jump to the top of the waiting list. But yes, they are open to people in the community with severe mental illness can also go to the supported employment providers.
We have a question from Lauren. Have you mentioned supported education? He had to step out a couple of times.
Yes. No, I did not mention supported education because we were just talking about supported employment, but supported education is available in the community. It's for post-secondary. So they don't help with GEDs, but if somebody has a high school diploma or equivalent and would like to go to a trade school or community college or a four-year college, something after high school, they will assist with that. They assist with the paperwork, you know, filling all that out and helping them do it. They do not pay for it, but they will help with the process of getting enrolled in a post-secondary education facility.
Okay, we have about 3 minutes left, so I'm going to do a last call for questions. And Dawn, if you could post the link to the training evaluation one more time. And if another question comes in, we will address it. But again, please click the link that Dawn's posting for the training evaluation. It has all the resources, the links to videos, certificates of attendance. If you can't get to it today, I will send it out again tomorrow so that you have it. And also a link that if you are interested in presenting a prep webinar and being one of our presenters, that you can complete the survey that I'm going to send out tomorrow and let us know, because we're always looking for new folks to share their expertise with your colleagues at the hospital. Next month's webinar is on October 18th, again, third Tuesday of the month at 3 o'clock. And next month, our presenter is Dr. Doreen Stanzione from Trenton, and she'll be doing a webinar on working with sex offenders. So we hope to see you all next month. Thank you all for attending, and thank you, Terry, and we'll be signing off. Take care, everybody.
Thank you.